The centre brings together the clinical care of patients with research into mitochondrial disease. And what we're trying to do in the centre, and I think what's pretty unique with the centre, is that we're able to use that to improve the lives of patients with mitochondrial disease.
In the diagnostic lab, our job is to take and receive the samples that are taken at clinic from patients with mitochondrial disease or suspected mitochondrial disease and try and work out what's actually wrong. So we may receive DNA samples taken from blood, or for some patients we may receive a muscle biopsy. And there are a number of different tests that are performed on that tissue which then will guide some of the genetic testing that we do later on, trying to work out what's wrong at the molecular genetic level.
Mitochondria form a small part of the cell, but it's actually quite a complicated part of the cell. So what we try to do in this group is to identify all of the components that are necessary for the mitochondrion to function properly. Once we've got that pattern, we know what happens, we can help identify what we need to do for the patient that might be able to improve their condition.
Sometimes the clinician will give a patient a diagnosis about a particular disorder, but we often don't know what the underlying cause of that diagnosis is. And a lot of the work that we do is basically trying to understand the symptoms and the causes of the disease.
We have very advanced equipment to understand the mechanisms of disease. We have the latest ways of looking at cells down microscopes, for example, which all helps with our understanding of mitochondrial disease.
Women who carry mitochondrial DNA mutations are at risk of transmitting disease to their children in a totally unpredictable way. They might have a child who's completely unaffected or a child who's very seriously affected. Our research here at Newcastle Fertility Centre is aimed at developing techniques that will greatly reduce the risk of transmission. So in principle, the techniques we're developing are based on IVF treatment. And this will give us an embryo which has the potential to then yield a pregnancy where the baby would have all the genetic traits of its parents but would have a very much reduced risk of having mitochondrial DNA disease. What we're doing has the potential to really, really make a difference to families because it will break that cycle of transmission, we hope.
What's essential for the success of the centre is this collaboration between both those starting their research career and those who are more senior. And what we have to do is bring people together into meetings where we discuss research findings and develop up new ideas, which are fundamental to finding out new ways to develop up treatments for patients. I think this is probably the most exciting time in mitochondrial research. We're really moving now from not really understanding mitochondrial disease and not being able to accurately diagnose it to an era where we are able to do that. And that, to me, having worked in the field for over 30 years, is very exciting. We are moving to a stage where hopefully in the next 5 to 10 years that all patients with mitochondrial disease will receive treatments.